Have you been able to log with the mobile phone to be able to manage microphones?
Hi, good evening, Julie and Sanjay.
Good evening. Good evening, everyone.
Yeah, I think Priyanka, one of the devices she's using is mobile phone, so I think it should be okay.
Okay, thank you. Okay, good day, everyone. Good evening, good afternoon, wherever you are being located, and we'll look at that in a few moments. Welcome to this first session of the collective learning certificate. Collective learning certificate, supply chain for health, which is the first classroom session, which is in fact an introduction to the course today. So thank you for registering online. Thank you for taking this course. We are very happy, Sanjay, Priyanka, and myself to welcome you in this course. So we're going to start. I will do the introduction. I want to apologize in advance that I may not be able to stay for the entire course today. I have a commitment, but I'll be at least half of the time of this 2-hour course with you. And then Sanjay and Priyanka will be here to take care of you. So the objective of today is really an overview of the course. We are going to be together for 4 weeks with some session in live like this one and other sessions which are going to take place on the Hive. So really today is an opportunity to get in touch with each other, understand the overall context of the course, and maybe some specific rules and ways of working. So the flow, we are going to introduce some concept. You will be able to ask questions. We will have some interaction. There will be some polls and some questions that will appear on the screen for you to answer. If you want to speak, you have a small face at the bottom with where you can click on it, a small emoji. And if once you click on it, you have some signs which are appearing. One of them is raising hands. So if you raise your hand, then we'll see that on the screen and we'll be able to give you the time to speak. Be careful with your microphone. It's very easy to mute and unmute. So if you have some background noise where you are, please make sure your microphone is muted. I think it's a good habit to keep it muted throughout the session when you're not speaking. As for the video, well, of course, there is the issue of the bandwidth, but feel free to put the bandwidth, to put the video if you feel that the bandwidth is allowing that, so that we can see faces, or when you speak, don't hesitate to put the video. We are always happy to put a face on the name and on the voice. So we are going to start with a quick introduction of Be Skilled. So who is Be Skilled? What is Be Skilled? Be Skilled has been is a training organization which is based on capacity and capabilities development. It has been funded for that, to develop and build, strengthen competencies and capacities in the public health workforce. So it's been built on the concept of learning together as one, which we believe in collective learning. So collective learning means that you don't learn alone in front of your computer, but you learn as a group, so that the knowledge that you have is something that can respond to knowledge of others, and then it will enhance and strengthen the collaboration in your own organization or beyond your own organization, within, global health system. So this is why we've developed this kind of scalable, low-cost solution. So we try to have an impact by being able to access as many people as possible. Today, you can have access on your computer through the Hive, which is a website that you can access directly from your browser on your computer. You also have an application which you can download on Google Play or on Apple Store, which will allow you to access all the course. So we hope that all this will make it very easy for you to access the content. And beyond the content, which is very important for us, is the opportunity to interact with your peers. And that's a very strong part of the collective learning. For us, collective learning is, as you can see here, a variety of options, a variety of service that you can access. But one which is really at the heart is the community of practice. The community of practice is we are gathering on this, on the Hive. The Hive is twofold. On one side, you have the learning system, the learning management system, where you have all the courses, all the content. And on the other side, you have a social network with the forum, with the exchanges, with the various profiles that you can engage with. So this is where the community of practice is being built on those two sides. You know, you have the capacity to engage with people who share the same topics, the same interest, professional, personal, educational, academic subject, all those topics you can share. The other element is knowledge management. You have access to a repository of knowledge, of information, whether it is policies, guidelines, research, industry standards, it can be a report, any kind of information that has been there is available here. It's also through the forum, all the discussions, all the exchange, all the questions which are asked and answered are also kept in the forum and can be accessed through an easy search engine that can allow you to access all this information. So you have this knowledge management, you have the community of practice, and then you have, as you've taken all, I think, before we start this course, is the skill assessment. So you have access to a skill assessment. This is open. You can access it anytime you want. If you want to redo the skill assessment test at the beginning, as you've done it, or after the course, or in 6 months, you will always be able to do the one you've done. More are going to come, you know, maybe more related to different courses and different subjects. But for the moment, you have this first skill assessment that you can access all the time. And again, being able to auto-evaluate your skill is really something we value, so that we will develop a lot of access and tools on that. It's also on the Hive, you also have a professional and social connection opportunity. It's again professional from the health system from various countries. We have over 1,200 people right now on the Hive from, I don't know exactly how many countries. I'm sure Sanjay could tell us that exactly.
About 60.
Well, about 60 countries. So 60 countries which are represented on the Hive. So really, there is a real opportunity for professional and social connection. Competency-based learning, as you'll see, every course that we propose is oriented towards acquiring very specific competencies. And so this is the competency-based learning is really also at the heart of our approach, making sure that we don't just share whether it is concept or whether it is tools or whether it is policies or practices, or we don't share this without having a clear view about what competency are we trying to develop. And finally, mentoring, supervision, and oversight. Of course, there is interaction that we can have during live session like this one. There are also longer-term interaction on the Hive that we can also engage in. And then there is a mentoring approach, a mentoring offer that we are also now piloting, and that will soon be on offer for everyone. So in a nutshell, if we look at those 6 offer, we can also try to summarize them, you know, about connection of various people, various professionals from various regions, learn new competencies in a social environment, find local and global information, local and global resource, and then engage with meaningful dialogue with peers and subject experts. So that's, in a nutshell, what some of the key features that you can have and find on the Hive. Now we are going to move to introducing the participant, but before we do that, we'll introduce ourselves. So my name is Gilles, Gilles Marion. I'm based in France. I'm speaking to you from Paris right now. I've been working in supply chain and public health in various countries for the past, I don't know if I want to say it, but for the past 30 years. Started in humanitarian health response in Caucasus, in Eastern Europe, then in Turkey, then in Afghanistan, then in East Africa, in Sudan, then in West Africa, where I've done a big part of my career, in Mali, in Francophone West Africa, but also Anglophone, Sierra Leone, Liberia. So I've worked in many countries. I've worked in France, I've worked in the UK, and always on supply chain, and most of the time on public health supply chain. So education is also an important part of my background. So it seems to be a kind of natural to end up in education in public health supply chain. And I hope that we'll have a fruitful exchange in the coming weeks. Sanjay, if you can introduce yourself, and then Priyanka, please.
Yeah, thanks, Gilles. Hello, everyone. So my name is Sanjay Saha. So I'm the founder and CEO of B-Skill. So I have been working in public health for more than a decade now. Have worked a lot in Asia, of course, in India, where I am right now, in other parts of Southeast Asian countries. And in the last 5 years, a significant portion of my work has happened in Sub-Saharan Africa, in different places in East, West, and Southern African regions. But in the last more than 2 years, we have been running this organization, B-Skill, which is quite important for us, for both Gilles and I together. We have launched this organization. So this is kind of the culmination of the experiences that we have had independently and together, working in different countries, in capacity development, donor-funded work, with ministries of health, with supply chain organization, national organizations, and we've seen, how important it is to learn collaboratively. So this is kind of the culmination of our experiences, and we hope, throughout these 4 weeks, we will be able to create a significant amount of value for you. So that's a bit about me. You can also find more about both of us in the course, and we are on LinkedIn, so you can also find us on LinkedIn. You can also connect with us on the Hive platform. You can send us messages there or on LinkedIn, and we will be happy to speak with you. Yeah, Priyanka.
Thank you. Hello, everyone. Very warm welcome to all of you. My name is Priyanka, and I'm from India, and I'm working as a community coordinator at B-Skill. So basically, my responsibility will be to coordinate with all the participants and assist them in case they face any sort of problems while they are part of the course. So yeah, welcome again.
Thank you, Sanjay. Thank you, Priyanka. So we are going to go through a round table for everyone to introduce yourself. Please don't take too much time to introduce yourself. I mean, we say 30 seconds, but of course, we are not going to be with a chronometer. We rely on you to keep that in the right time. And yes, feel free to put the video if you want to put the video. Feel free to share if there is something you want to share, particularly. If you can just, when you speak, you give us your name, your full name, your country of origin, where you are. If where you are is not your country of origin, perhaps you can tell us both. I would be happy to hear both. If you have a specific qualification that you want to share, your background in terms of qualification, but also your position and your organization, your job role, your responsibility, your organization. So those five things, those 5 points which are here, we'll be happy to hear from you. We are going to go through the list of participants, but just before we do that, you can see here on the map. I don't know if you can see very clearly if it's large enough. But basically, you have a representation of people coming from all the countries which are now being represented here. So large part coming from Nigeria, it seems. But let's move on, and we'll see. So perhaps, and of course, I'm going to call the names one by one. And so I apologize in advance for the names that I won't pronounce well, and please correct me when you speak. So we are going to start with Nosiba Abd El Halim. Please, can you take a few seconds, a few seconds to present yourself?
Yeah, she's not here.
Okay. So we are going to move to Jeanette Alemou. Jeanette Alemou, can you?
Okay. Can you hear me?
Yes, we can hear you loud and clear.
Thank you. My name is Gannet Alemou. I'm from Ethiopia. I'm a pharmacist working in Ethiopian Pharmaceutical Supply Agency. I'm working in quantification and market shaping directorate, specifically for quantification of malaria products, which is for health program commodities. Thank you.
I'm That's the only thing.
You're welcome.
That's the only thing you will hear me saying in Amharic. But thank you. Thank you very much.
Thank you.
Can we hear Said Malik Keba, please? Are you here?
Yeah, he's here.
Okay. Said Malik Keba? No. Okay, let's move to Hubert Alofa.
Good afternoon.
Hi everyone.
Sorry, Hubert. Let's Said speak, and then we'll come back to you. Yes, Said,
Okay,
please.
okay.
Said Malik,
Yes,
please.
good afternoon. I'm Said Malik Kebe from the Gambia. I'm a pharmacist by background, working with National Aid Secretariat as the Procurement and Supply Chain Management Officer. I'm in charge of the procurement of Global Fund funded item, malaria, TB, HIV. Currently, I'm in Ghana doing my master's in procurement and supply chain management. Thank you.
Thank you very much, Said Malik. Can we hear now from Hubert Alofa, please?
Okay, good afternoon, everyone. My name is Hubert Alofa. I am pharmacist working at National Medicine Regulatory Agency, especially in the Department of Vigilance, Rational Use, and Clinical Trial. And I am very happy to participate to the training and I don't have any height level in supply chain for health. That is why I subscribe to this training so that to strengthen my skills in this domain. Thank you. Yes.
Thank you very much. Thank you very much. Can we have from Lamine Niger, please?
Good afternoon to you all.
Good afternoon.
I am Lamin Jai, pharmacy technician, procurement and supply chain officer, National Malaria Control Program, the Gambia. Thank you.
Thank you, Lamin, and sorry for misspelling your name. Can we know you from Yaya Fatou Marone, please?
Hello, everyone. My name is Yaye Maron. Bonjour, Gilles.
Bonjour, Yaya
Ça fait
Fatou.
plaisir.
C'est plaisir de t'entendre.
Yeah, bien sûr. My name is Yaye Maron. I am originally from Senegal, but now I'm based in the United States. I've been working in supply chain since 2016 with the USAID project, such as Deliver, PSM. Lately, now I'm working with the Reproductive Health Supply Coalition, and I am a supply chain analyst. So I'm not a pharmacist. I'm more focused now on data analysis, like inventory data, and training also Francophone country users of a system that we are calling Global Family Planning, Visibility and Analytics Network, on to acquire, the right skills in order to be able to manage their data in such a system. So my focus is mainly on family planning products for now. Thank you, and I'm really happy to be part of this, to take part of this training. Thank you.
Merci beaucoup, Yaye Fatou. Merci.
De rien, merci.
Puis vraiment, c'est un plaisir de te revoir. Là. Merci.
Oui, c'est partagé. Merci.
Donc maintenant, on va demander à Chilette Kwashira de se présenter. Sorry, I've moved to French now. My mistake. So please, can we hear from Chilette Kwashira, please, right now?
Yeah, she's not here, Gilles.
Okay, sorry. Folita Malonda, are you with us? No, I don't see Folita Malonda. Matthias Ngong Joya.
Not available.
No. Arom Akagu. Aromi Akagu.
Hi. Yeah, I'm here. Can you hear me?
Yeah, we can hear you.
Good evening, everyone. All right. My name is Arome Akagu. I'm from Nigeria. I work for Save the Children International. I have worked as supply chain assistant supporting a nutrition program here in Kogi State. I have an engineering background, which is why I have deemed it fit to take this course to develop my supply chain in the health sector. Thank you.
Thank you very much. Can we hear from Premise Kayembe? We hear you very badly. Yes, please. Yeah. Can you start again? We heard you. The connection was... again. We heard you.
Okay, my name is Premise Kayembe from DRC, original, or DRC, Democratic Republic of Congo. But now working in Chad. I've Bachelor of Public Health. In Chad, I'm consultant with UNICEF. Thank you.
Thank you very much. So the connection is not very good with Chad, it seems. But we understand you are a consultant with Ministry of Health, and you are from DRC originally. So thank you.
Thank you, Gilles.
Thank you very much.
Merci beaucoup, Gilles.
Merci bien. Ahano Okao, please, are you here?
Hello. Yeah,
Hello.
good evening, everyone.
Good
Yeah.
evening.
My name is Ahana Okao. I live in Lagos. I'm based in Lagos, Nigeria. I'm a pharmacist with over 20 years of experience in the pharmaceutical industry. Prior to that, I was briefly in public health, working with National Program on Immunization, and also with a brief stint with them in regulatory with NAFDAC. I am currently the managing consultant in Han & Stel, and having worked in the pharma industry across sales marketing, I'd had very close working relationship with supply chain and inventory management. And I'm here to hopefully broaden my knowledge and strengthen my skills in supply chain in public health. So I'm looking forward to learning a lot and also contributing as much as I can to topics of discussion and conversation. So thank you so much for having me.
Thank you. Thank you very much, Hanno, for this introduction and for this word also on being able not only to get, but also to provide and to contribute. So this is really what we try to create is interactions. We believe like it's like in the brain. What makes people reflect is not too much the number of cells you have, but the connection you have between you, the neuronal connection, which really makes the brain works well. So we try to really create those interaction in this course. So thank you very much. Can we hear from Ehab Al-Ashkar, please?
Yes, my name is Ehab Al-Ashkar. I am from Iraq. I am working with the International Medical Corps. My position is Medical Commodities Manager. Currently, I have been moved from Iraq mission to Ukraine. I'm waiting now my visa to move to Ukraine. So just I wanted to correct that, because in the table they put it Ukraine, but actually I work in Iraq mission. I am going to move to Ukraine soon. My job responsibility is to oversee the whole process of supply chain, starting from sourcing of medical commodities from the vendors and at the manufacturers levels in outside country and from inside country, until deliver those items until to the delivery points. Thank you.
Thank you very much, Ehab. Can we hear now from Ukamaka Okafor, please?
Okay. Good afternoon, everyone. I'm Ukamaka Okafor. I'm a pharmacist, and I work in the Pharmacist Council of Nigeria. I live in Lagos. I've done a lot of supply chain courses, but generic ones. None has been focused on health, and that is why I want to take this course, because it's health focused. Thank you.
Thank you very much. Thank you very much, Kamaka. Can we now hear from Samayog Karmasharia, please?
Yeah, he's not here.
Okay. And then can we hear from Noor Abdullahi Hassan?
Hello, good evening from Somali.
Good
My
evening.
name is Noor Abdullahi Hassan. I'm logistic officer for UNICEF Somali, and one of my main role is managing of supply chain, especially encountering transportation and logistics. I also provide technical advisory to national supply chain strengthening, where we also focusing on the building of the national and supply chain system as part of health supply chain system. And educationally, I am development and also conflict side, from development and conflict and study side, but I'm doing my master in supply chain management at Salford University now. And having said that, I've also been with UNICEF for about 16 years. I'm looking forward to learn more about and supply chain health, and also gain the experience and knowledge sharing from colleagues even with the different African countries I've seen. It's very interesting. I'm looking forward to gain and best opportunity to widen my knowledge and also share, contribute as more as I can. Over to you.
Thank you very much, Noor Abdullahi. Thank you really for this for your introduction to all. And as you've just said it, Noor Abdullahi, it's good that we have a very diverse profile of participants. So it should be rich exchanges. And right from the start, it's already very humbling to see all those diverse experience and expertise in supply chain and in health and in other sectors, which are now joining us for this course. So we'll hope that you'll find here the right content and the right frame, the right environment for those exchanges, and to really contribute to a collective enhanced learning, collective enhanced knowledge. Just a quick poll before we move on, just to know about your internet access. If you have some, we are going to send the poll right now. And please answer about your internet connection. If you want to make some comment about your internet connection on the chat box, please don't hesitate to do so. Can we launch the poll?
There seems to be some glitch. Priyanka is trying to sort it out.
Okay. We can do the poll after if that's an issue. Please, if you think you have we are going to launch the poll. There is a small delay into this. Just put on the poll if you think you have some on the poll on the chat. Don't hesitate to put some information if you think that this should be taken into consideration for the course. If you have some access which are complicated or some issues, as the poll is now here. So please, you can answer the poll. And again, don't hesitate to put any questions you would like to put on the chat. Sanjay, I will leave you to take it from here. I will stay with you for a few more minutes, but I will have to leave. I'm not going to interrupt while I'm leaving. So I just want to say one last time, because I'm not going to speak again today. We should meet on Thursday anyway for the first classroom lesson. So we'll meet again on Thursday. But again, very happy to be part of the team today and for the next 4 weeks. So thank you.
Okay. Thanks, Gilles. So just to conclude the poll, I think majority of the participants, they're using it on the phone. So I think we recommend using the app if you are using it on the phone, whether it is Android or Apple. you can go to your respective Play stores and look for B-Skill Hive. There is also a link for the app right at the end of this session, and you will be sent this PowerPoint, so you can also download them. But in case you're using it on your phone, we highly recommend using it through the app, since it is much higher user friendly than if you use the browser on your phone. So with that, I think there's one person who says his internet connection is not very fast. So again, if your internet is not very fast, it is again advisable to use the app, because the app uses less bandwidth than if you're using it on your computer. But again, we'll have it. It's on with you how you want to access it. You have various options, and all the options have the same kind of content and same kind of structure in terms of learning. And we'll show it to you as well in the end of this class. So moving on, what I want to do in the next 10-15 minutes is to give you a brief idea of this entire course that is beginning, that has already begun actually yesterday, and I have seen a lot of participants have already completed some lessons and also participated in some discussions. So congratulations to you all who have already gone through some of the course. But as you see here on the slide, this is the first collective learning certificate series, number 1, supply chain for health. We are launching part 2 in July. So you will also have access to it, in the coming months. But for this one, it's a 4-week course. We give 2 additional weeks, but the main core part of the course where you have, weekly sessions, responses with responses from instructors on forums, any Q&A, all those things they run for the core 4 weeks, wherein it's about a 24 learning hours program, inclusive of all the classroom sessions, inclusive of all the discussions, course content, reading materials. The key part, it's a 24 hours course. The design of the course is based on European qualifications framework. So it's a framework which is used in all the universities and schools across Europe. So we have used the same framework, which is called a learning outcomes framework. Where we know from the very beginning what you are going to achieve once you finish the course, and this is also being told to you at the very beginning of the course, and the entire course structure is designed accordingly. So that, with each lesson, with each module, we are able to give you those, competencies that we have written in the very beginning, that what you're going to learn. Also, the competency assessment that you have done in the beginning, that is also very closely associated with the course. So all the competencies that were listed in your assessment, they can be developed through this course. To variable extent, depending on how you do this course. Some participants in the past, we have already certified close to, rather more than 200 participants on this course. And a majority of them, they have reported that, they have been able to apply some of the things that they have learned in the course, while, some of the participants have reported that it has led them it has led to increase of knowledge for them. So it really depends on different people. But as an ideal scenario, all the competencies that were listed, in the assessment, you should be able to gain those competencies through this course. There's a very specific element of peer-to-peer learning on this course, which you will not find in any other online course on public health supply chain. This is very specific to this course, where you see each other, listen to the instructors, speak with each other, listen to each other through these classroom sessions. But you can also do the same things over the platform Hive. We will show you later how you can connect with each other, how you can send messages to each other, how you can talk on the forum, how you can create your own discussions in the group that we have created for you. There there used to be a learning competition for this course, and unfortunately, we're not doing it for this session. I mean, if you want, we can do it. But it has been told to us in the previous cohorts that it takes a lot of energy on the part of people, since you're also working. So we can send you some of the guidelines for the learning competition if you want. We can do it in this cohort, but that will be totally dependent on you, as a group, not on a couple of individuals. Eventually, and finally, this course will lead to an international CPD certificate. So Be Skilled has been certified by a UK-based organization called the CPD Certification Service. This is one of the oldest certification service for online learning and distance learning programs, and they have certified very big organizations from UNICEF to private sector like Bosch and Lomb, those kind of people who do private sector professional courses. They've also certified a lot of organizations in the NGO sector, like Save the Children, some of their courses, and several others. So it's the same organization who has certified us to be a CPD provider, global CPD provider, and hence the certificate that we issue after this course has a global relevance, global significance, where you can showcase this as a part of CPD program. We are also in the process of working with national CPD associations, like in Nigeria. We are discussing with Pharmacists Council of Nigeria, or I think Pharmacists Council of Nigeria, I think, where Madam Okafor is working at the same organization. Then we're also talking to Pharmaceutical Society of Kenya. So we're also trying to get this course accredited nationally by national accreditors, so that the pharmacists who are working in those countries can receive national credits as well. But that's a work in progress. But hopefully, in the coming year, this course will have some national credits as well for different countries. At a high level, if you look at the learning outcomes, and these are the same learning outcomes which you may have seen in the competency assessment as well, because the learning outcomes are linked with competencies that we want you to learn throughout this course, and then based on these outcomes, the entire course has been structured and designed. So I'll just quickly read out these key 6 learning outcomes, which starts at a very high level, where we would like to explain the importance of supply chain in the health system and for achieving universal health coverage. The first point is very important in understanding each one of your role as well, not just in supply chain, but also more importantly in the much wider health system. Because all of us, we are eventually working in a health system, whichever way we look at it. Some of you are more closely related to the beneficiary, let's say the patient, while some other may be distantly working towards the health of the patient and the population at large. So through this course, we would also like to establish this importance that your own work profession has towards this health system and for achieving universal health coverage, which is a key target for all the countries that has been represented even today, for all the countries by 2030. And probably all of you know that we are way behind that target. I mean, even before COVID, we were behind that target, but now with COVID, that target is even far. So our role, all of us, collective roles become even more important to be able to somehow reach near to that target of universal health coverage. Next, the course will help you demonstrate the complexities of a public health supply chain. I think all of you have seen how complex a health supply chain can be. It's very different from a private sector supply chain, let alone a health. I mean, it is very different from a private health supply chain. It is extremely different, or it is kind of the supply chain logics are same, but in terms of how it is operated, it is kind of very, very different from a supply chain of FMCG goods or other products like in our sector we give a lot of comparison with we see a lot of comparison with Coca-Cola. But I can tell you the supply chain in health is really different from that of a Coca-Cola. And you will also see that in the course why it is different. It's not to say that the concepts of supply chains are different, but there are other complexities with health supply chain which we feel that people don't really appreciate, and hence this is also covered in this course. Then discuss the key concepts, processes, and stakeholders in a public health supply chain. And this is linked to the second learning outcome as well, that why there is a complexity because of some key concepts of health, because of certain processes which is related to health systems and stakeholders. And for the stakeholders, there is an assignment that you will see at the end of week 1, which is very important. And it is important for everyone to understand the kind of stakeholders that are there, in the management of health supply chain for any country. And it's very important to understand that to be able to have a broader view of how a health supply chain is managed in a country or in a program, even for a single product, for example. I see a lot of you're saying, either you're working for a family planning product or a HIV program, someone is working for, let's say, global fund products like HIV, TB, malaria, now probably COVID-19 products as well. So it's important to understand who the stakeholders are for each of your perspectives. Then describe how quantity, cost, and quality of products can be managed. This equates to forecasting, quantification forecasting, relates to procurement, relates to how quality of products can be ascertained during procurement. So this particular learning outcome relates to these supply chain functions. Moving on, explain the key downstream functions required to make products available to patients. This involves the functions of storage, warehousing, transportation, and the last mile. So these will also be covered in this course. And finally, identifying the supporting functions which enable the supply chain operations. Now, you see, even today, all of you who are here, you said you're working in a specific function of supply chain. Someone said, okay, I'm involved in the end-to-end process from, I think it was Ihab who said, from sourcing of products from locally or internationally to, when it reaches to the beneficiary or the service delivery points. So he's involved in all those supply chain functions. Someone said they're working, they're working. I think there's someone who's missing. I think today she's working in a hospital, I think. So that's kind of the end point. Someone is working as a consultant who's looking at the supply chain as a whole. But nowhere we saw someone, I think Guy said she's working on the GP van project, which is about visibility, which is about managing data, which is about how decisions can be taken using a set of particular data which is coming from supply chain. So these kind of functions like data visibility, like quality assurance, like performance management, monitoring, evaluation, human resources, these kind of things, these are the key enabling, and of course leadership management, these are the enabling functions which make a supply chain good or bad. And it is equally important for you to understand as supply chain officers, consultants, to understand how these impact your specific roles wherever you are in that value chain, so that you can coordinate with the right people in making your jobs easier while making the system better as well. So it's also important to understand this thing, identify those issues, and then address them. So in total, we cover the entire spectrum of supply chain from the core functions to enabling functions. However, in this course, the main focus is on the core functions. And then there is one module which focuses on making you understand which are those enabling functions. And then the second course, which is going to be launched next month, will focus in depth in those enabling functions to make this journey complete from selection of products to the last mile, plus also the enablers which makes this process, which supports this process, which makes this process easier than the others. So this is how we have designed this course. And while you will go through the modules, you will see there will be learning objectives under each of these learning outcomes linked to each of the modules as well, so that this journey can be complete. So moving on, this is the course calendar, which I believe has been shared with you already by Priyanka. We would really recommend and encourage you to follow this course calendar, because if you do follow this calendar, it will become much better for you to learn and participate in the forums, participate in these classrooms. Of course, there may be some times when you are busy in work, you're not able to participate, but that's okay. All these classroom sessions that we do, we record them and we again post it back on the platform, so that whoever has missed this can take a look at these 2-hour sessions whenever they can. But it is important to follow this calendar, because the final assessment that you will see here, which is on the final week of this course, it includes questions from all these places. It not just includes questions from the modules and lessons that you will go through on the platform, but it has some questions from the classroom programs, classroom sessions. It has some questions from the additional materials that have been given to you as part of your self-study. Although it's not a large portion that is allocated to the self-study and classroom sessions, but still there are some questions which are attributed to these sessions. So if you don't participate in all of these things, you may miss out on some of the questions at the end, which may affect your final score and may also affect your chances in getting the certificate. Now, in the calendar, as you see, there are some color codes. The light blue color, which marks the discussion, starting of a discussion. Some dark yellow, which is the Zoom sessions. This is the only Zoom session which is happening on Tuesday. The rest, all of them, they happen on Thursdays, 4 p.m. GMT, same time. This is to make sure that almost every one of us are kind of at a time where it is accessible. Otherwise, someone is in US, it becomes really difficult for them to join the course. We have had several participants in the past from Haiti. So we take into account, that's why there's a time which takes into account that wherever the people can come from, they can join. Even in the past, we've had some people from Southeast Asia. So at least there is a chance for them to join, so that's why it's kept at 4 p.m. GMT. Here, every week there is a specific focus. So for example, week 1 we have module 1 and 2. Week 2 we have 3 and 4. Week 3 module 5. Week 4 module 6 and 7. Now it doesn't mean that at the end of week 1 you won't be able to access module 1 and 2 anymore. The module 1 and 2 will be there, whenever you want to access it. But the point is that if you access it within week 1, then when you come to week 2 and on Thursday, when there's a classroom session happening on forecasting, and if you are following this calendar and if you have gone through week 1 and you are on week 2, it becomes easier for you to follow what's happening in the classroom. But if you have not covered week 1 and part of week 2 as part of this calendar, then when we're doing the forecasting class, you may be a bit lost because you have not gone through the background material which is on the platform. So that's why it's important to follow this calendar. Then every week there is some kind of an assignment. Week 1, there's an assignment which will take you probably 3 to 4 hours to complete. Week 2, the assignment relates to the classroom session that is happening on 7th of July. Week 3, it's very interesting. It is a group classroom session. Here the classroom session itself is the case study and the assignment. So, in the classroom session, we will create 2 or 3 breakout groups, like 2 or 3 groups, for example. Each of the group will go through the scenario. Each of the groups will prepare collectively their joint response and then submit that response respectively on the platform when they come to the assignment. So it's very important that you participate in that classroom session to be able to submit that assignment, because if you don't submit the assignment, you can't move ahead. Of course, if there are some issues, genuine issues that you can't participate, then you can take help of people who participated, but it is not advised, because some people who have participated, they have done all the hard work, and then just like we used to do in the school, we copy something from someone and just submit it. So that's not advisable, because then you don't learn what we're trying to do through that case study. And then again on week 4, there's an assignment which you can do by yourself. So this is how the course structure is aligned for the 4 weeks. We give 2 additional weeks at the end, where there are no classroom sessions, where there are no additional discussion forums. But if you are lagging behind in the course, you can use those 2 weeks to finish up your course on the platform, because it is important for you to complete the course on the platform and do the final assessment to be able to qualify for the certificate. Before we move ahead, I would like to launch a quick poll to understand if you have received and if you're following the course calendar. So very quick poll. It's on your screen now. It would be good to understand how many of you have received it and you're following it. I request everyone to please participate in the poll. It's a quick one. It will also help us understand if someone has not received it, so that we can send the calendar to them again. And Priyanka, also post the calendar in the group.
Yeah, sure.
So that it is always available under the documents section.
Okay, I will do that.
Okay. A couple of people who have not responded, but let me quickly go to the next slide while we wait for those couple of people. Now, as you saw in the calendar, there were some color codes, and the same color codes if you see here. The blue ones are, the core lessons in as videos, discussions, quizzes, case studies, reading materials, which are directly on the platform on Hive, which you all are member of. If someone has joined the Hive today, I don't know, Priyanka, maybe you have given the access to everyone. If not, the access will be given for the course to everyone who have created their accounts. Once you have got the access, you will see that you have access to all the modules, you have access to all the documents related to the modules, discussions and everything. So you will have access to everything. Then every week there is a Zoom session, like I said, and then every week there is a weekly assignment. Some assignments you can do by yourself, and there is one assignment which is a group assignment, where you come together, share your thoughts, do it together, and then submit it. Okay. I think everyone has done it now. So as you see, I think everyone has received the calendar. There's some who have not started to follow it yet. So we will encourage you to read it carefully and then follow it, so that you can make the most of this course. Okay. Moving on, you have done this evaluation, the competency assessment. Unfortunately, the slide is still in French. We do this course in French as well. So sometimes the boundaries between English and French, they get a bit blurred. But I think we have some participants from Senegal, originally from Senegal, Benin, DRC, so you will definitely understand this. So if you have not done it yet, it is highly recommended to do this. Whoever has completed it so far, I believe your reports have been sent. Please go through your reports, look at the areas where you need more learning, more knowledge, more practice. And if there are some areas where you're very good, just keep on with it. Get more knowledge on that, get more practice on that, understand the best practices that there are on those areas. so that you can move higher in your career. Eventually, once the course finishes, you will get this CPD certificate. As you see, it is labeled under the CPD certification service, which is the certification partner for us. This certificate will have your final score from the final assessment. It will have the course learning outcomes. It will have names of the modules as well. This certificate will also have a unique ID through which anyone, wherever you share this certificate, if anyone wants to confirm that, you have actually, received this certificate, because today, in today's world, there are a lot of fake certification that people also showcase. But in case if someone wants to confirm your certificate, they just need to send this ID, which is in this format as you see here, SC4H1 and then some dates or year, and which is specific for each participant who ever received this certificate. So if any organization where you submit this certificate, they want to confirm this, they can send us this code. And if this code matches with the name that we have in a database, we'll send them a confirmation letter that yes, indeed, this person has completed the course successfully and has received this code. So this is the certificate. Now, it is important that we clarify the rules of obtaining the certificate. Now, as I said earlier, we have been certified by the CPD certification service based in the UK, and they're very strict in terms of the compliance. And if we don't comply with the rules, they can revoke our license. Now, one of the rules that they have is that the certificates are only issued to participants who successfully complete the course, and the courses cannot be, they cannot be just given in a way where participants have unlimited attempts to learn, because there is no learning if you just keep on attempting the questionnaire again and again until you get it right, then there's no point. So there is a very strict criteria that we have 5 attempts. 5 attempts, I think, are good enough for everyone. And within those 5 attempts, you have to score 60% or higher. So you will get 50 questions in that assessment. There will be a designated time. And we consider the highest score that you obtain after 5 attempts. But it is important to finish within the scheduled 5 attempts. Otherwise, you will not receive the CPD certificate. You can receive the certificate of completion, but you won't receive the certificate of the CPD certificate. The date here, unfortunately, is wrong. So the date until which you have to do this is 6th of August. So by 6th of August, if you complete this course totally 100% with 60% score in the final assessment, you will receive the CPD certificate. In case someone has completed the course and has not been able to achieve the final assessment score, they can retake this course again in the future cohort, or they can also undertake the assessment again by paying a penalty. If someone has not completed the course 100%, they will not be able to access the assessment, and hence the certificate will not be issued. So it is important to understand that, one, you have to complete 100% of the course on the platform and pass the assessment. So two criteria, these are important. We are announcing it at the beginning of the course, that there is no confusion at the end, for anyone. So I'll quickly pause if there are any questions at this point. Anything that additional that you want to know, I'll just pause for a few seconds, and then I think the next part of this session will be taken over by Priyanka. So any questions? Don't think so. It has been quite straightforward. I see Shailet has joined us. So excellent. Shailet, welcome. We missed you in the beginning, but it's great that you could join us today. So you will receive the link for the recording later. So please do take a look at the beginning of the session that you have missed. Thank you.
Okay, thank you very much for welcoming me. Unfortunately, my time was a bit different from yours by 2 hours, so I was waiting for the past 2 hours, hoping that you will be in class. Then when I checked, now I realized that others are there already. Now I know the time. Thank you.
Excellent. It's really good to hear your voice, Shailet. So Shailet has been a Hive member for a long time. She has tried to access this course earlier as well, but for some reason she could not. We're really happy, Shailet, that you are here this time, and we hope you will make the most out of this course. So if there are no questions, then I'll hand it over to Priyanka. Priyanka, okay, let me help you with the slides. So I think I'll have to stop sharing as well. So Priyanka, I think you're going to take us live to the Hive platform so that everyone can understand how to do it in a live environment, right?
Yeah, okay.
Okay, excellent. Then I'm stopping my sharing. Yeah. Over to you, Priyanka.
All right. So everyone, I am now going to present a brief tutorial about how to navigate the course on Hive platform. Just a second. So I guess I don't know.
Priyanka, we see the PowerPoint. We don't see the Hive.
Just a second. Yeah, is it fine now? Can you see the PowerPoint now?
Yeah, it's the PowerPoint. We are not on the Hive.
Yeah, just a second. So I will be sharing the Hive platform. Yeah. Okay. So firstly, you have to open your web and like here to open your web. You after opening your web, you just have to you have to visit hive.bskill.com first, and then you have to enter all your credentials, your email ID and your password, and then you click on login. So once you log in, like I have logged in to my account now. This is my Hive account. So as you can see, first of all, so after you log in, I'm going to tell you how do you navigate to the course. Here is the option for courses. So you go to courses, click here. And here you can see some courses, but this one you have to go to. This one is your course, CLC 1, Supply Chain for Health. So you click here. When you click here, the course page is open now. As you can see on this page, there is entire content of the course. So there are 7 modules, and then there is course evaluation, and then the final assessment. Also, I'm just going to tell you how do you access the course. So you look at this small triangle here. You always have to click on this small triangle, and then there are lessons which are open after every module. So for example, you want to go to module 2. I'm just going to show you how to access module 2. So you click on this triangle, and then there are videos, there are discussions, quizzes in the course. So once you click on the video, So I'll click on the video. You have to make sure that the video is finished till the end. So if I finish the video till the end, it is very important to note that there is a mark complete button at the end here, mark complete. So you have to click on this button, mark complete, in order to move forward to the next lesson. So yeah, this green tick will come once you finish that lesson. This green tick will show you that this lesson has been completed and now you can access the next lesson. So the next lesson is also a video, so I'm going to leave this one. So for example, you have discussions. You can take part in the discussions. So here you can simply click on this button, reply, to be part of the discussion. Then there is knowledge check, which is a quiz. So if you click on the quiz, you have to start quiz. You need to score at least 70% to pass the quiz and progress in the course. So you have to answer all the questions. You don't have to leave any question. Otherwise, you won't be able to proceed to the next lesson. So after you complete all the questions, you will be getting a quiz summary and your score will be there. Yeah. So this is how you will be able to access the course and complete the course. I'm just going to show you how you can access groups. So here is the option for groups. So you go to groups. So this one is your group collective learning certificate, supply chain for health.
Can I just make a small comment? Yeah.
Yeah.
So this group is like a classroom for everyone. So like in a classroom, you can see who your fellow learners are. So for example, Priyanka, if you go to members.
Yeah. So here you can go to members.
No.
Okay,
the members
group
in the group.
Okay, sorry. Yeah. So here are group members.
Yeah.
So currently we are 21.
Exactly. So this is like a classroom where you see all the members, you see the course, you see what each of the members are doing in the feed, and Priyanka will explain. So this is like a classroom for you. So Priyanka, over to you.
Yeah. So here you can see, so members, you've seen a feed. In the feed, you can see all the updates. Then there are discussions, course is the same. And then over here, you can find all the documents. Like for example, I will be uploading this course calendar and FAQ document. So you can, if you don't find it in your mailbox, you can find it on the platform itself. Then there is Zoom. If you go to Zoom, here you will find the Zoom links for all our prospective Zoom like classroom sessions. So yeah, this is how you can access the course and everything about the platform. You can, ask me if there is any doubt.
Yeah, Priyanka, Noor Abdullahi is asking, he has logged into the account, but he is not able to access. Maybe his account
Yeah,
has not been
so
updated.
I would like to mention that Noor Abdullahi has just registered a while back. So he has not been made member of this group.
So Noor, after this session, Priyanka will add you to the course, and then you will be able to access. Priyanka, can you also show user profile? Last point on this slide.
User profile.
Yeah.
Okay, just a second.
Yes.
So about user profile, you can go to this picture, like you can click on this picture. It will be your picture if you've uploaded it. So you can click on profile. So your entire profile will come here. Yeah, so here under profile, you can add all the information about you to complete your profile 100%.
And then on the profile, sorry, Priyanka, just wait on.
Yeah.
on the profile. Sorry, can you go back to the profile?
Yeah. Yeah.
On the profile, you also see some points.
Yeah.
Although Priyanka, it doesn't show on your profile, but for example, if you go to the main members list, if you go to the
Main
main
members.
members
Yeah.
list, and just open one of the participants from the previous cohort, for example, yeah, for example, Bani, yes. So just show his profile. Yeah, excellent. So for example, if you see here, Barley has 24 CPD points, 200 gems, and some more points. Now, and he also has some achievements as well, like she's showing now. Yeah, like a CPD badge. So these are the things that you receive. So for example, points you receive when you do some activities on Hive, like sending some requests, email requests to people to join the Hive, or submitting something on a forum, or for example, writing a blog. So you will see on the blog page there are some students who have written some blogs for us. Gems you receive once you finish this course. So each collective learning course, you receive 200 gems. For the CPD certificate courses, you receive a CPD badge. And as you have seen initially when I said that this course is worth 24 learning hours, so you receive 24 CPD points. The gems and the points are important because very soon we are going to be bringing new courses, and some of these courses would be accessed using these gems or points that you accrue during your course duration or participation in different events on the Hive. So make sure you have a lot of points and gems so that you can access some of the future courses for free. And one of the courses which is coming very soon is called Effective Waste Management. That is for all the public health professionals who are interested to understand how different wastes are managed in health. So these kind of courses in future as well will be accessible through these points as well. So Priyanka, over to you.
Yeah. So coming back to our presentation. So let us come back to our presentation. Here you can connect with your fellow learners as I showed you. Under members category, you can find all the group members, and you can simply click on this button to send them a connection request, and you can be friends with each other, like we basically find in on any app like Facebook and everything. Then moving on, you can find all your notifications and private messages. So over here, this bell icon is for notifications. If you click on it, you'll get all your notifications. And here, over here, there is an icon of messages where you can find all your messages. Then there is an
Priyanka, can I just make a quick
yes.
comment?
Yeah.
If you go to the previous screen, so messages you can also send within the group, this group that we have created. So if you go to the group that we shown earlier, there is a tab of send messages. So you can send messages within this group of 16, 17 people, including us, the instructors, and Priyanka, who is the community manager, so that all of us will receive the message that you will send, and we can then respond back to you, or anyone can respond to whoever has sent that message through the same way by looking at this message icon here and then responding back to the message. Ihab, you have raised your hand. Please go ahead if you have a question or a comment.
Yes, thank you very much. Actually, I have idea. I don't know if it is applicable or not, but can we create like a smaller group on the WhatsApp using our phone numbers for all participants, and with like with you and with the other colleagues from the B skills to be available there, so I think because sometimes we have difficulty in joining the internet through the website, but it is more easier for us to communicate through the group. Thank you.
Yeah. So Ihab, you've already gone ahead in the presentation. I think so. Priyanka was actually going to ask this in the end. If everyone is comfortable to share their mobile numbers, the WhatsApp mobile numbers, then we will create a WhatsApp group for this course as well, so that it becomes even more easier. We understand Ihab very much. Sometimes it's not possible to send emails or write in the groups on Hive. So we will create a WhatsApp group. If everyone is comfortable, please write your WhatsApp numbers in the chat, and then Priyanka will note them down and create the group later on. But also, just one more point, Priyanka, before
Yeah.
you carry on. But also, if you're using the Hive app, it is very easy to send messages through the Hive app as well. So we'll also encourage you to try to use the Hive app as well. But yes, we will be creating a WhatsApp group. So Priyanka, over to you.
So this is more better. Like I have left my number, so all of you like can message me your number so that I can create a group. So I've left my number in the chat box. So yeah. So moving on, there is an interesting feature of notes. Like you can take notes by clicking here, take notes button, which is on the platform, and you can write down your thoughts while learning whatever you're learning, and you can even save it for later. And then like I will be emphasizing once again on the importance of mark complete button. So after completing a lesson, I've already told you that you have to press this button, mark complete. But in order to complete a module, also you have to click on this button, mark complete. If you will not click on this button, you will not be able to proceed to the next lesson or module. So now there is a time for the poll. Have you understood the course, platform, environment, and features? Yes, I now understand how to participate in groups, discussions, courses, and engage with other members. No, I have not fully understood the groups and discussions. So you can answer quickly. Or if you have any problem, you can even leave it in the chat box right now. So 83% have understood and 17% have not fully understood. So if you have not understood, you can leave your messages in the chat box here, or you can send a mail to me. I have written my mail ID in the chat box as well.
Yeah, please, in order to fully understand everything, please do write to Priyanka either through email or through WhatsApp. She's also given her WhatsApp number, and then she will help you understand the platform fully. Well, it's important to understand the platform environment because it helps you better in this knowledge sharing and knowledge attainment. So Priyanka, over to you.
Yeah, so moving on. So you can now have learning and networking at your fingertips. You can download the Hive app, Be Skilled Hive app on Google Play, and it is now available on App Store as well. So if you are an Android user, you can get it on Google Play, and if you use an Apple phone, you can download it on the App Store. So here are the codes which you can scan to download the app, or you can just simply write down on the Google Play or App Store, Be Skilled Hive, to download the app on your phones. So now there's a time for another poll.
Yeah, the final one. Please don't get discouraged.
So this is the final one. Have you downloaded the Be Skilled Hive app? Yes, I have downloaded the app and using it. Yes, I have the app but haven't used it. Yes, I have the app but facing some difficulties. No, I haven't downloaded the app.
We would really appreciate if you download the app as well as if you're using it on the web. You can use it on both places. You can learn on the go. If you travel to your office, you can log into the app, look at some of the things through the app, and then continue when you have a laptop and an internet later on wherever you are. It's very convenient. If you want to participate in discussions, using the app is very convenient rather than using it on the web. If you're using the platform on your phone on the web, it is much easier downloading the app again. So we really recommend downloading the app. Even if you still use the web platform for certain things, you can still have the app. Because if you have the app, you will get notifications when someone responds to something. You will get notifications when we send some key information to you. So downloading the app is highly recommended. If you haven't downloaded the app, please do that. I hope everyone has a smartphone available, either Android or Apple.
Okay, so 70% are already using the app. So we would encourage rest of the participants to download the app. Now, if you have any questions, you can simply ask them in the chat box. Also, I would like to mention that I have received numbers from only 6 participants as of now. I'm just going to send you a mail also that if you feel comfortable, you can just send me your number on WhatsApp directly, and then I can create a group.
So any question? I think this is the last slide, Priyanka, right?
Yeah, it was the last slide.
Yeah.
Thank you.
So any questions, if you have any clarifications, this is the time. Today's session was just information session. We are not going through any technical materials in this session. The session on Thursday, 2 days later, it will be the first technical lesson for the course. So we request everyone to be present during that session. Again, the recording even for this session will be available to you through email or on the Hive group, the group that we have shown you. If someone was not able to participate throughout the session, like I see, someone has joined and their name is Redmi Note 7. I'm not sure who that is. So if you're able to speak, can you tell us your name, where you are joining us from? Redmi Note 7. I see you are moving from one place to the other, so probably want to speak. It's important to know who's joining us so that there are no spammers here. Sometimes these links can go to some people who are not part of the course somehow. Redmi Note 7, are you able to hear us? If you want to speak. Anyone else, if you have any questions about the platform, about the Redmi Note 7, can you?
Yeah, it's Polita Jisomo Malanda from Malawi.
Excellent. Welcome, Polita. We missed you in the beginning. It's really good to see you. And please access the video of the recording of this session later on. Priyanka will share the details. So, but welcome again, and we hope to see you in future sessions.
All right, thank you so much.
Excellent. So
Yeah.
any other questions, clarifications about the platform, about the course, about how to do it, please, you're welcome. Otherwise, we will close this session in the next 5 minutes.
All right.
Okay, I don't see any questions. So I think Priyanka, thank you so much as well, Priyanka, for presenting this. I think we have come to an end for today's session. Please again do join us on Thursday. We go through the first technical session of this course, which is focused on stakeholders and supply chain governance, and specifically for public health and health supply chains. So do join us. Some really interesting topics on Thursday, and please log into your accounts and start going through the modules and follow the calendar. So really, we appreciate your presence. We appreciate your time. We know all of you are working, so we'll not keep you for long. It was really great to see you all here, and we'll look forward to some exciting collaboration throughout the next 4 weeks. So thank you, and we see you again on Thursday.